am Krutika Patel. I am working as research fellow at UN Mehta Institute of Cardiology and Research Center. Today my session is on statistics test, odds ratio and hazard ratio. Odds ratio. Odds ratio is a measure of association which quantifies the relationship between an exposure and outcome from a comparative study. When we are doing comparative studies like case control study, we can see inside the table two groups, exposed and unexposed. For simple equation of odds, odds that a case was exposed upon odds that a control was exposed is equal to AD upon BC. Odds is a numeric expression of the strength of association between cause and effect when both expressions as categorical variable. A thumb rule for use odds ratio is both variables are categorical variables. The increase in risk associated with each odds depends on the rate of the outcome in the study. Odds show only correlation of two variables, not causation. It means when we can see the correlation between two variables, but we cannot found any cause between two variables. Odds ratio is a simple tool widely utilized in case control studies, clinical research, and meta-analysis. Calculations of odd can be done easily with the help of an online calculators and software like SPSS, Stata, and Metcalc. I can show you some calculations of odds. In example 1, in 100 births, the probability of delivering being a boy is 51% and being a girl is 49%. The odds of a delivery being boy is 51 upon 49 is equal to 1.04. This is our odds. Odds in simple equation, number of event occur upon non-event. And we can discuss example 2. This is clinical example for odds. In study examining the association between estrogen, this is exposure, and endometrial carcinoma. This is outcome. This calculations is shown in this table. According to the table above, individuals with endometrial cancer are 4.42 times more likely to be exposed to estrogen than those without endometrial carcinoma. Then interpretation of odds. Odds ratio is equal to 1. This indicates exposure does not affect odds of outcome. Odds is greater than 1. This indicates exposure associated with higher odds of outcome. If odds is less than 1, it indicates exposure associated with lower odds of outcome. Then we can discuss another test, hazard ratio. Hazard ratio are frequently used to estimate the event effect for time to event endpoints. A time to event analyzes the time from the start of the study. For example, randomization in study to an event, for example, death. Hazard ratio allows a measure of association in outcome in survival curves. Main goal of hazard ratio, how one group changes relative to another. Hazard ratio represents the instantaneous event rate, which means the probability then an individual has survived to that particular point of time without experiencing any event. The hazard ratio is measure of risk. For example, in case of hazard ratio is 2, means the event will occur twice as often at each time point, give 1 unit, increase the second. Uses of hazard ratio in survival analysis to compare the risk of occurrence of an event of interest. For example, death in two groups, for example, treatment versus control group at a given time. Hazard ratio used in observational study, randomized clinical trials, and prospective cohort studies. Hazard ratio received from survival analysis like Kaplan-Meier, Cox regression, and log-rank text. It can be also calculated from statistical software. Now we can see interpretation of hazard ratio. Hazard ratio If hazard ratio is equal to 1, means lack of association between two groups. If hazard ratio greater than 1, suggests group 2 are at increased hazard compared to group 1. If hazard ratio is less than 1, suggests group 2 are at decreased hazard compared to group 1, a smaller risk. Now this is curve of Kaplan-Meier curve. This show a time to event progression. Red light indicates treatment group and blue line indicates control group. When the decrease is in the graph, it shows end of the study. The time to event curve or Kaplan-Meier curve, as time progress, percentage survival decrease in both groups. Plotting curves on the graphs allows statistical analysis to be performed to calculate the hazard for each group. Hazard model only determines whether the treatment are different or not, but do not indicate how much one treatment is better or worse than the other. This is called the limitation of hazard ratio. Dividing the hazard ratio and the control room produces the hazard ratio. One study performed by Clinical Journal of American Society of Nephrology, the title is AKI associated with higher risk of cardiovascular events 1 year after discharge? They take large number of cohorts patient matches with AKI and without AKI. After post-discharge, they take follow-up of, after 1 year, they take follow-up of these patients. After 1 year, they found primary outcome, heart failure, acute coronary syndrome, peripheral arterial disease, and ischemic stroke. These all are primary outcome. In 4 of them, hazard ratio of heart failure is 1.4. So we can conclude that AKI is independently associated with this event, especially heart failure after discharge. Thank you for listening me.